Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about pseudogout. Now, we talked about gout on one of our last videos, and with gout, it's a deposit of uric acid or urate crystals in the joint that cause a red, hot, swollen foot. Pseudogout is very similar, except the crystals that are being deposited are the calcium pyrophosphate crystals, and these calcium pyrophosphate crystals may deposit right in the joint themselves. Sometimes they can actually deposit on cartilage. They can cause joint damage, creating symptoms similar to an osteoarthritis, and they can be pretty painful. Now, the interesting thing about this is they really don't know the cause. They don't know why it's happening. They notice that all of us have these calcium pyrophosphate crystals in our blood. It seems to increase as we get older. Over 85, for example, 80% of individuals have a pretty significant amount of calcium pyrophosphate, but not all of these individuals get pseudogout. Not all of these people have symptoms. Things that seem to cause it. Age, of course, increases your risk. Joint damage or injury can increase your risk. Genetic factors, which they can't explain, can increase your risk. All these are problems, all these are issues that can cause the pseudogout. So how is it treated? Pseudogout is treated in a similar fashion. Ice, anti-inflammatories like ibuprofen. In some situations, some rare situations, you can actually stick a needle in and draw it out, called arthrocentesis, where we draw out the crystals and you can send them to be evaluated. Once they're evaluated, you can confirm whether it's gout or pseudogout, although a lot of times it's pretty difficult to draw out the fluids, especially in the foot and ankle area. The most common spot for pseudogout would be the knees, but it does happen in the foot. So if you got a red, hot, swollen foot, it is worth being evaluated because it could be gout, could be pseudogout, could be fracture, could be infection, could be Charcot, destruction of the bones themselves or whatever. So the idea here is if you got a red, hot, swollen foot, especially if it's increasingly painful and getting increasing pain rapidly, it's worth being evaluated and get a diagnosis so you know what your best treatment options are. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 380, pseudogout. I recommend that you get evaluated if you think that may be the case, because there are definitely things that we can do, definitely ways you can treat it, so that you can live in a more comfortable life with that problem. So if you want additional information, you want to reach out to us, you can go to utahfoot.com, and we'd love to help you, especially if you think you may have gout or pseudogout.